Hello everybody, my name is Gail Eskery. I am a certified diabetes educator, and today I'll be making the second video about the diabetes. A few things that I would like to discuss is the risk factor of development of diabetes, the screening, how to decrease the risk factors, role of exercise, dietary changes, and role of certain medications, and as well as some targets to achieve a good blood glucose level. So first thing is screening of type 1 diabetes. So screening of type 1 diabetes is not routinely recommended. It is only estimated based on your family history of type 1 diabetes, age of onset, the gender of the affected family members, and certain genetic markers. While when it comes to type 2 diabetes, there are certain factors that are involved, especially the family history, because around 75 to 90% of the people who have family history of type 2 diabetes are at high risk of developing type 2 diabetes. If you are a member of high risk population, like your race, socioeconomic status, if you have a history of gestational diabetes, history of heart disease, or if you have end organ damage, like if you have nerve damage, if you have eyesight problems, if you have kidney disease or heart issues, you're at high risk of developing type 2 diabetes. And also if you're like around 40 or over, it's a good idea to get it assessed, get your A1C level checked, which is a 3-month level blood sugar, and monitor your blood sugars. Because it's very, very important around that age. There are lots of risk factors that can actually lead to diabetes while you're unaware. Then the next question rises is like how to reduce the risks of developing the diabetes. So unfortunately, currently there are no preventative therapies for the development of type 1 and type 2 diabetes. The only thing we can do is make some lifestyle changes. First thing first, when it comes to type 2 diabetes, you can make certain changes and those will help. But for the type 1 diabetes, there are essentially no changes that you can make and they will make a difference because the criteria for that is very well unknown. So lifestyle changes, impact of lifestyle changes, especially exercise and dietary modifications is very, very important. If you are diabetic, it's very important to start some sort of exercise, at least brisk walk for at least 15 to 20 minutes to begin with, increases to 30 minutes every day, up to 150 minutes per week. That's the goal. And if you can reduce your weight by 5%, like if you're, say, 100 kilogram, and you lose 5 kilograms, that has a huge impact. It reduces your risk of getting the type 2 diabetes or cardiovascular disease or the heart disease by 60%, which is very, very significant. So it's very, very important to look at those benefits of exercise. So exercise at least 5 times per week, 30 minutes every time, and also if you can add some weight-bearing exercises, that's also important. Like weight-bearing exercises at least once or twice weekly is important. So the other thing is about your diet changes. So diet change also plays an essential role in obviously reducing your weight. So there are certain kinds of diet. Mediterranean diet is one of the very important ones. There is another one called DASH diet that is to help reduce your blood pressure. So having a balanced diet is very, very important because that plays a huge role. That should include your whole grains, some fruits, some roots, vegetables, nuts, legumes, olive oil. Those are very, very important. Also, there are certain medications that can play an important role in keeping your diabetes under control or helping you kind of reduce the risk of developing diabetes. So those medications can only be started if you're pre-diabetic. So if you're like not diabetic, we're pretty much in the range. So metformin, and there are certain other medications also. I won't go into details about these medications right now. I'll make a different video about that. Certain people ask about the bariatric surgery. Yes, bariatric surgery, because you're losing weight, you're not gaining more weight, so it doesn't directly impact your diabetes, but yes, in the end, you do get benefit about that. Next thing that I want to talk about is your 3-month blood sugar level, your A1C. That's very, very important to control your A1C because it predicts your risk of heart disease and other complications of different nerve damages. So there, for different age groups and different people, there is different ranges for the A1C. So the first one is the most common range. So your A1C for a diabetic patient should be 7 or less. So that's for most adults. But if you want to reduce your risk of developing a heart disease or chronic kidney disease or to stop the nerve damage, that will be less than equal to 6.5. So if you can control your A1C level by under 6.5, that will be beneficial. But we have to look at the low blood sugars as well. So if you're at risk of developing low blood sugar, so that level might not be a good level for you. Next one comes like if you're functionally dependent, then your blood sugar levels, like targets, are a little bit higher. So your target would be between 7.1 and 8. So that's for your A1C. But the targets also change for different other categories like if you have limited life expectancy, if you're frail, elderly, if you have a history of dementia, if you have a history of low blood sugar and your blood sugar significantly gets lower, then your blood sugar level target, your A1C target, would be 7.1 to 8.5. By the end of life, we just want to control the symptoms, so we don't have to worry about your targets for the A1C. So those were the few things that I wanted to talk about. So your blood sugar, controlling your blood sugar is very, very important. As long as you can keep your A1C within the target limit, your risk of developing kidney disease, the eyesight issues, heart problems will be way less. If you have any questions, you can reach out to me directly. Thank you very much. Have a good day.